Hi, I'm Dr. Ramesh Kumar, Senior Consultant Physician working in Bangalore for CareFit. Today we are going to open up a very important topic on obesity and hypertension and how it's affecting our daily lives. Obesity is a major problem affecting not only in adulthood, it's also in childhood. In Indians, we have a very characteristic form of obesity. We put lots of weight around the center. So we call this the thin fat Indians, is abdominal obesity. Now this fat which is accumulating around the waist is called the bad fat, is the visceral fat we call it. And that contributes to a lot of insulin resistance and all other metabolic problems which we see, including hypertension, diabetes, cancers, inflammatory disorders. So we are seeing a lot of obesity these days, and the reasons are multiple because people's lifestyles have changed. There's rapid urbanization, there's less physical activity. By and large, we are actually built very small. That means we have a lot of fat, we have less of muscle tissue compared to the Caucasoid race. And how do you term obesity? Obesity is termed in the Western population as BMI more than 25. But in Asians, we take the cutoff as 23 BMI. So if any BMI above 23 is classified as overweight, more than 30 is class 1 obesity, more than 35 is class 2, more than 40 is morbid obesity, class 3. So how do we tackle obesity to counteract hypertension? So important thing is always diet, exercise, all the healthy living habits. So somebody can cut down their weight by even 10%, you do a lot of good in the form of reduction in blood pressure. So obesity and hypertension actually go in hand, mainly because there's a lot of insulin resistance. Even a 10% weight loss can cause a drop of almost 4 to 5 mm mercury drop in your blood pressure. So it's very important to tackle the weight as the primary care. Second thing important is counteracting salt. Cut down your salt, lots of potassium, fruits and vegetables in your diet, and of course be physically active at least for 30-40 minutes. Dietary sodium to be restricted to almost 3 to 5 grams per day. We Indians are known to take lots of salt, almost 10 grams per day, 8 to 10 grams. And obviously last, limiting your alcohol intake, which can also contribute to elevated blood pressures. So simple lifestyle change can actually bring about a lot of reduction in your blood pressures. So obesity, tackling obesity is a first step, then doing the other lifestyle modification is the second step, and of course see your doctor if your blood pressure persistently remains high, you have to be on medication. Today we are going to talk on obesity and the link with hypertension. Now what is obesity and why is this becoming more prevalent? Obesity is a common disorder not only in the Indian world but also in the Western world. It's a global problem. And why is this happening? Because of rapid urbanization, lifestyle change, people getting less physically active, and the use of all the other electronic gadgets, people, even including childhood obesity, is becoming more common. Now how do you classify obesity? Obesity is basically a height-weight ratio we calculate as a simple term called body mass index. A body mass index of more than 23 in a nation is classified as overweight, more than 30 is obesity, more than 35 is moderate obesity, more than 40 BMI is morbid obesity, that is severe. Morbid obesity is not good because this leads to a lot of medical problems. Today WHO has classified obesity as a disease. It's no longer a disorder, it's a disease because obesity by itself leads to many metabolic problems, including hypertension, elevated blood sugars in the form of insulin resistance, uric acid problems, other inflammatory disorders, cancers. Now why is it so peculiar in Indians? Because Indians typically are called the thin fat Indians. We have less of muscle mass, we have more of fat. Where do we put on this fat? The fat is predominantly around the waist. That's the bad fat we call it, the visceral fat. This visceral fat contributes to a lot of insulin resistance. So counteracting the weight around the mid circumference helps in the long term. So if you cut down your body weight by 10%, it does a lot of good things to you in the form of reduction in blood pressures, reduction in blood sugars, reduction in your triglyceride levels, and of course the whole metabolic overload comes down. So counteracting obesity is the first step in tackling the global problem of hypertension and diabetes and cancers. Now obesity is very common, including in childhood. So we should start right now in the childhood to counteract this weight issues right into the adult. Now what is this BMI, obesity and hypertension? Obesity leads to a lot of vascular resistance, insulin resistance. Insulin resistance gives rise to elevated blood pressures. Elevated blood pressure leads to a lot of target organ damage, including damage to the heart, eyes and kidneys on the long term. So cutting down your body weight by 10% reduces your overall load or systolic blood pressure by almost 5 mm. So tackling obesity is the first step in bringing down your disease burden. So the second important thing in obesity management is you are tackling even diabetes. So diabetes is a disorder of glucose metabolism. Now that also leads to diseases on the long term on affecting the high heart and kidneys. So it's very important to tackle obesity as a primary step to control all these metabolic disorders. What is the first step you do? It's important to cut down calories, important to cut down salt, important to cut down spirits, alcohol, lead a moderately physical active lifestyle, everyday exercise 30-40 minutes, which contributes to a persistent weight loss. It's very easy to lose the weight initially, but then the persistence of that weight is very important because that gives to your long-term morbidity and mortality. So change in dietary habits, lifestyle modification, cutting down salt, improving your potassium intake in the form of fruits and vegetables, cut off spirits and smoking does a lot of good to you in the long term. So tackling obesity is like tackling including hypertension and diabetes. Today we are going to talk about bursting the myths about high blood pressure. Now high blood pressure is a very common problem all over the world. Now why is it so important to bring down the blood pressures? Blood pressure can cause target organ damage. One of the most common targets involved are the heart, eyes and the kidneys, and obviously strokes. Now controlling blood pressure is very important right from an early age. Now high blood pressure is termed high if any adult above the age of 18 years has a systolic pressure of more than 140 persistently and above, or a diastolic blood pressure more than 90 and above. What does really happen in high blood pressure? It actually worsens the stiffening of your arteries on the long term, decreases the blood flow to all your vital organs, leading to long-term damage. Now, blood pressure is mostly silent, and that is the reason why it is called silent killer. What is the first myth? High blood pressure is not a big deal. No, it is a big deal. Doctors consider this as a big deal because controlling blood pressure leads to definite reduction in heart disease, strokes, blindness and kidney disease. That's dialysis. So it's very important to get your blood pressure under control. The second myth is high blood pressure can't be prevented. Yes, it can be prevented. If you are leading a very healthy lifestyle, you can control your blood pressure just with dietary modification and lifestyle modification. Very important to maintain an ideal body weight. You can do this with healthy eating and exercise. Cut down your salt intake to almost 2 to 3 grams per day. Limit your alcohol, smoking, exercise regularly and don't build your stress. Myth 3, is it okay as long as one number is normal? No. We have two readings in blood pressures. There are two readings, systolic blood pressure, diastolic blood pressure. Generally in younger people below the age of 50, it is the diastolic blood pressure that goes up. Above the age of 50, 60 is the systolic blood pressure. It's very important to get both the readings down because both of them affect your organs equally. So it's important to get both the readings down. Fourth myth is treatment difficult. Treatment is not difficult because just with your dietary modifications of cutting down your salt, alcohol, getting your weight into an ideal body weight zone, taking a lot of potassium in the form of fruits and vegetables definitely brings down your blood pressure. So also alcohol and smoke. Medications should be started in consultation with the doctor if the blood pressure remains persistently high. Initially we start with one drug, it may end up with second drug, sometimes it ends up with 3 drugs, but it's very important to follow up with the doctor. So medications can control your blood pressure and cutting down your cardiovascular risk and stroke risk in the future. Myth 5, treatment doesn't work. In fact, you work with your doctor to develop a comprehensive program to manage blood pressure. You have to maximize your plan so that you can check your blood pressure as recommended by your doctor. Follow your treatment plan, follow with your doctor regularly, watch out for side effects, inform the doctor about side effects, and always get regular blood pressure checkups either at home or office. So taking the medication regularly, controlling your diet, getting your body weight into a healthy zone, reducing your salt, reducing your alcohol consumption can actually bring down your blood pressure. But most important, please follow up with the doctor regularly to get your blood pressure in the target zone. So learning about high blood pressure is very important and is the first step in controlling this condition so that you can remain healthy for years to come. Thank you.